Detailed physical.
Detailed physical exam.
Okay, what did we do?
You look for?
Sorry?
What do you look for?
So yeah. Okay. So if you want me to explain completely, we will look. So it's about inspection and palpation. So look for, anyhow, this is a chest pain patient. So we are not expecting any bleeding or any injuries. But however, as we are doing a detailed physical exam, let us do a comprehensive exam, a detailed one. So I will inspect and palpate his head for any injuries, decap, TLS, any depressions, any swelling or any stuff. Then I will come to his ear. If I have otoscope, I will use it. Otherwise, I will use my torch. You are sitting on torch. I'll use a torch to see his ear. I'll also look at the other ear. Then I will look at his eye, pupil response. I will look at his nose for any bleeding or any fluid discharge, something. I will look for integrity of his nasal bone. However, this is not a trauma patient, so I am not concentrating much on the trauma part of it. I will check his mouth. Say okay. I'll look for his pharynx and his tonsils and all those. Then I will go to his neck. His neck, one thing I will do is I will palpate the neck for any tenderness. I will look for JVD. I will look for trachea in the place. I will check it if the trachea is in the middle. I will auscultate the neck for what? For the carotid groove.
For carotid what?
Hold your breath.
حقت ايش هذه؟ ايه.
This examination, this auscultation of carotid artery is for to check. For example, we explained just before, his the artery which is supplying to the heart has a block, isn't it?
Yeah.
The same way, his artery which is supplying to the brain might also could have a block. So there are some treatments which you cannot give to this patient if he has a blockage in the carotid artery, because the clot which is there, which might dislodge and it will escape to your brain, and that can cause a stroke. That's why carotid.
Aspirin. Can I give him aspirin?
No, it may escape to the.
No, aspirin no problem.
Why?
Aspirin doesn't do anything with the current clot. Aspirin has nothing to do with the current formed clot. The clot will be clot. Aspirin's job is it remains 70 as 70 or 80 as 80. For example, if this is the shape of, for example, if this is the shape of the clot, the aspirin will keep it remained as it is.
For how long?
As long as the aspirin's effect is there. That's why your doctor asks you to take one aspirin every day, 75 milligram, for such patients in future. So as long as the aspirin's action is there, they take continuous aspirin therapy. So I finished here. Then I will come to the chest. I will inspect and palpate the chest for the structural integrity, that is his ribs fractured, anything, shape and chest expansion. Then I will go to auscultation, as we have done before. Now examine also the posterior side of the chest. Now the examinations which you want to do is somewhat, it needs your patient to be lied down. Okay? So if your patient is sitting on the structure, make him to lie down for further exam, because abdomen needs lay down, all other parts need a little bit laying down. So you have finished all this part until chest and the back of the chest by sitting the patient. Now you could ask your patient to lie down. So what we will do is
lay on the floor.
For example, if this is an actual patient, you need to explain your patient, sir, I would like to examine your abdomen and the remaining part of your body. We need it. I will not take more than a minute to examine. That would actually will add into your treatment, which will help us to treat you better. So, yeah, you will be all right with that. So explain your patient what you're going to do. Convince him to lie down on the table to examine him, the abdomen and other parts of the body. Yeah. So only thing is the main is abdomen. You need to put his legs up, and you need to. So let's do it. Please, could you, where is the blanket? Take the blanket out.
ثاني صح؟
So let's assume our patient is on structure.
انبطح يا بني.
In actual situation, you need to expose the patient, okay? You need to expose the patient, but for time being, I'm not exposing.
Why?
I'll just explain you. So I finish this part. The next is, I will put patient's legs like this. Now I need to inspect and palpate the patient's abdomen. When you inspect, look for any bruises, the bicapitalis part of it. Second, any distension of the abdomen, any discoloration of the abdomen. For example, you will see discoloration around the umbilicus. That is a. Have you learned about Cullen sign and Gray Turner sign? Did you do homework? Gray Turner and Cullen signs. Okay, go on look there. Cullen signs and Gray Turner sign, which you will see when you look at the skin discoloration. Okay. Then you palpate. You start with the right side from the lower vein, and take breath. Relax.
Why we ask him to take a breath?
Because when he hold it, you cannot do it. When he exhale the breath out, his abdomen goes inside. So actually you can feel the internal organs like liver and spleen when he exhale out. So take breath, relax, take breath, relax. So you do it in a clockwise direction, okay? And leave the painful area last. Take breath. Any pain? There's a pain? Okay. So check is full, check is right quadrant for right lower quadrant for most probably the prominent structure there, which could be a problem is appendix. When you come to the upper right quadrant, you have liver there, you have gallbladder there, spleen is not here, spleen is other way. You have head of pancreas over here, then you go to the middle, you have stomach there, body of the pancreas there. When you go over there, you have the major organ spleen there and tail of the pancreas there. And you come down, you have bowels all over the abdomen. And also you have urinary bladder over here. Urinary bladder. So this finishes the inspection and palpation of abdomen. The second thing remaining is auscultation for bowel sounds and percussion for abdominal percussion note. The normal abdominal percussion note is tympanic. The normal one, which has limited air, which could be dull. Shmani dull? Dull shows either it has fluid or it has solid masses. That means there is no sound. It should be a little bit tympanic because abdomen has some gases, isn't it?
Yeah.
But it's a dull, blub, 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 dull sound which doesn't show you sound, or you can feel the.
It doesn't show. Does not. Yeah, you cannot feel any air or any space. The dull sound. There is no space.
If there is, the normal abdomen has some gases.
Okay.
So when you percus, it will be tympanic sound.
Okay.
When there is fluid or any solid masses, the sound will be dull. If in any case, if there is extra gas, that will turn hypertympanic or hyperresonant, hypertympanic. We use the word hypertympanic. But usually tympani is normal and dull is with fluid and masses. Then you go to the remaining exam as we learned in the inspect and palpate this. When you come down here, it's very important. What will you check here?
PMS.
Pulse, motor, sensory and movements. Okay, tone of these things. Examine also the hand for inspect and palpate, pulse, motor, sensory, movements, grip and all those details. So here you actually finished entire examination, detailed physical exam. Now you jump it to ongoing exam. Yes, please. خلصنا. هذا كان medical patient. He was sitting. He examined his back while sitting. ما شوف. If trauma patient, this will change. We will log roll him and we will change. This would have been done in instead of OPQRS.